Imagine feeling tired all the time, dealing with mysterious aches and pains, or developing unexplained rashes. What if these seemingly random symptoms were actually early signs of a serious condition? That's what lupus can do, hide in plain sight. In this video, we're going to talk about 10 early signs of lupus that you should never ignore. Identifying them early can be life-saving, so make sure you watch till the end. We'll explore the early symptoms, why they occur, and what you can do to manage them. Let's get started. What is lupus? Before we dive into the symptoms, let's first understand what lupus is. Lupus is an autoimmune disease, which means that your body's immune system starts attacking its own tissues and organs. This can cause inflammation and damage to various parts of your body, such as your skin, joints, kidneys, heart, and even your brain. There are different types of lupus, but the most common is systemic lupus erythematosus. What makes lupus so tricky is that its symptoms can vary widely from person to person, often mimicking other diseases, which is why it's called the great imitator. Now let's move on to the 10 early signs of lupus that you should be aware of. Sign number 1, fatigue. Fatigue is more than just feeling tired. This kind of exhaustion is overwhelming and often doesn't go away, no matter how much rest you get. Lupus fatigue can be one of the earliest and most challenging symptoms because it interferes with daily life. It can make basic tasks like getting out of bed, going to work, or even socializing feel impossible. Why it happens? This happens because lupus causes chronic inflammation throughout the body, which takes a toll on your energy reserves. Your body is constantly fighting itself, leaving you feeling drained. Some people may also develop anemia, which is common with lupus and contributes to this extreme fatigue. How to manage it? While there's no cure for lupus fatigue, managing your energy is key. Make sure to get plenty of rest, break up tasks into smaller steps, and try not to overexert yourself. Moderate exercise can also help maintain energy levels, but always listen to your body. Sign number 2, joint pain and swelling. Joint pain is often one of the first signs of lupus. It's not just stiffness, it's persistent pain in the hands, wrists, knees, or ankles. Unlike other types of arthritis, lupus-related joint pain tends to affect both sides of your body symmetrically. You may notice that the pain flares up for a few days and then subsides. Why it happens? Inflammation caused by lupus can damage the soft tissue around your joints, leading to pain and swelling. This is particularly common in lupus patients and can mimic rheumatoid arthritis. How to manage it? Anti-inflammatory medications, regular gentle exercise, and physical therapy can reduce joint pain and stiffness. In severe cases, a rheumatologist may prescribe stronger medications to prevent joint damage. Sign number 3, skin rashes, butterfly rash. One of the hallmark signs of lupus is the butterfly-shaped rash that appears across the cheeks and the bridge of the nose. This rash is usually triggered or worsened by sun exposure. Lupus can also cause other types of rashes on your skin, often on areas exposed to the sun, such as your arms and face. Why it happens? Lupus affects your skin by causing inflammation and hypersensitivity to sunlight. This leads to what's known as photosensitivity, making your skin vulnerable to UV rays. How to manage it? Wear broad-spectrum sunscreen daily, even indoors. Avoid prolonged sun exposure and wear protective clothing. If rashes persist, your doctor may prescribe creams or ointments to reduce inflammation. Sign number 4, sensitivity to sunlight, photosensitivity. Many lupus patients experience photosensitivity, meaning exposure to ultraviolet UV light from the sun can cause flare-ups or worsen existing symptoms. This may result in more intense skin rashes, fatigue, or even joint pain after sun exposure. Why it happens? In lupus, your immune system becomes overly reactive to UV rays, triggering an immune response that can cause rashes and other symptoms. How to manage it? To reduce flare-ups, protect your skin by wearing sunscreen with at least SPF 30, limit time outdoors during peak sun hours, and wear hats or long sleeves when outside. Sign number 5, unexplained fevers. Lupus often causes frequent low-grade fevers, typically between 98.5 degrees Fahrenheit and 101 degrees Fahrenheit. These fevers aren't caused by an infection but are a result of inflammation in the body. While they may seem minor, persistent low-grade fevers are a red flag that something more serious could be happening. Why it happens? In lupus, inflammation in your body can elevate your temperature. This happens because your immune system is constantly on alert, even when there's no infection present. How to manage it? Keeping track of these fevers can help doctors diagnose lupus early. Over-the-counter fever reducers like acetaminophen may help, but it's crucial to report persistent fevers to your doctor. Sign number 6, hair loss. Thinning hair or hair loss can be one of the earliest signs of lupus. The hair may become brittle, thin, or fall out in patches. Lupus-related hair loss often affects the scalp but can also extend to other body parts, including the eyebrows and eyelashes. Why it happens? Inflammation of the skin, particularly on the scalp, can damage hair follicles and cause hair loss. Sometimes the medications used to treat lupus can also contribute to hair thinning. How to manage it? If hair loss is caused by lupus, treating the disease can help. Gentle hair care routines, avoiding heat styling, and discussing medication options with your doctor are ways to prevent further damage. Sign number 7. Chest pain, pleurisy, or pericarditis. Experiencing chest pain while breathing deeply could be a sign of pleurisy, which is inflammation of the tissue surrounding the lungs. Lupus can also cause pericarditis and inflammation of the sac around the heart, leading to sharp chest pains. Why it happens? Lupus causes inflammation in the body, including around vital organs like the heart and lungs. This inflammation can cause the tissues to rub against each other, resulting in pain, especially when breathing in deeply. How to manage it? Anti-inflammatory medications and rest are often prescribed to reduce pain. In more severe cases, corticosteroids or immunosuppressive drugs may be used to control inflammation. Sign number 8. Kidney problems, lupus nephritis. One of the most serious complications of lupus is kidney damage, known as lupus nephritis. Early signs include swelling in the legs, feet, or around the eyes, as well as foamy urine or a decrease in urine output. Why it happens? Lupus causes inflammation in the kidneys, which can impair their ability to filter waste from the blood. This could lead to long-term kidney damage if not treated promptly. How to manage it? Early detection is crucial for managing lupus nephritis. Routine blood and urine tests are used to monitor kidney function. Medications to control inflammation can help prevent further damage, and in severe cases, dialysis or kidney transplants may be required. Sign number 9. Cognitive dysfunction, brain fog. People with lupus often report experiencing cognitive issues, commonly referred to as brain fog. This includes difficulty concentrating, memory lapses, and problems with focusing on tasks. Why it happens? Lupus can affect the central nervous system, leading to cognitive dysfunction. It's believed that inflammation in the brain or blood vessels could cause these mental symptoms. How to manage it? Keeping a healthy brain involves staying mentally active, getting enough sleep, and discussing with your doctor whether medications may be contributing to cognitive issues. Cognitive therapy may also be helpful in managing these symptoms. Sign number 10. Mouth and nose ulcers. Mouth and nose ulcers are common early signs of lupus. These sores are typically painless but can be recurring, appearing inside the cheeks, lips, or nose. Why it happens? Lupus-related inflammation affects mucous membranes, leading to the development of these ulcers. They may flare up during periods of high disease activity. How to manage it? If you experience these ulcers frequently, your doctor may prescribe topical treatments to reduce pain and speed healing. Avoid spicy or acidic foods that could irritate the ulcers further. And there you have it, -10 early signs of lupus that you should never ignore. Remember, lupus is a complex disease that affects each person differently, and catching these early symptoms can make a significant difference in managing the condition. If you or someone you know is experiencing any of these signs, it's essential to consult with a healthcare provider to get the right diagnosis and start appropriate treatment. Early intervention can help slow the progression of lupus and prevent complications. If you found this video helpful, don't forget to like, share, and subscribe to my channel. Hit the notification bell so you never miss out on more valuable health tips and advice. Let us know in the comments if you'd like us to cover any other health topics, and as always, thank you for watching. Stay healthy, stay informed, and we'll see you in the next video.